Yes. So I'm going to initiate the session. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today, 18th February 2022, then we are going to start the speaking session, complete speaking session, one warm-up session and two role plays. It will last for 20 minutes and afterwards we'll have a feedback session. Right. Yes. So, yeah, right. This one, same. Yes. So this is Grandmaster class and speaking session. Hello, Karuna Neherkar. How are you?
Yes, sir. Hello. Good evening. Good afternoon. I am good, sir.
Good afternoon.
Thank you for asking.
Yes, we are going to start the session now and
Yes,
everything
sir.
is fine. So, yes. So, Karuna Neherkar, nursing specific occupational English test. She is from Mumbai, Maharashtra, India. This is the speaking warm-up session. These are the daily dosage profession specific speaking materials. And these are profession specific speaking tasks. Karuna, can you please tell me something about yourself in 3 to 4 sentences?
Yes, sir. Thank you for giving me an opportunity to talk regarding to introduce myself. So my name is Karuna Neherkar. I'm a nurse by profession. I had worked with the Lilavati Hospital and Hinduja Hospital, which are the multi-specialty hospital in Mumbai. Currently, I'm working with the Tata Institute of Fundamental Research as a health promotion nurse.
Fine. Why did you choose nursing as your profession?
Well, there are a number of reasons behind choosing this profession. Firstly, I love to help needy people, and with the nursing profession, I can help actual needy people. Secondly, there are various opportunities available globally for the nurses. Thirdly, nurses are considered as angels, as they are treating patient and contributing their care to give second life to the patients. And I want to be one of them. And so here I am.
What is your fundamental reason for taking the occupational English test?
Occupational English test is my one of the English language test which is need to be clear before getting job into the my dream destination UK. And I feel that this test is related to my profession, and I feel more confident in OET rather than other language tests. So I took this test for my to show my English proficiency.
Which country is your most favorite destination for migration and work?
My favorite country is United Kingdom, as I would like to work over there, and also I would like to relocate there.
Comment on the special qualities of the contemporary nurses.
Nurses carries too many qualities to be a good nurse. Firstly, they must be a good listener. They should listen patient carefully, and accordingly they should respond to the patient. They need to be a good communicator, not only with the patient but also the colleague. They need to be a good critical thinker, decision maker, and they should have updated knowledge. They should be patient while caring to the patient, and working with the colleagues. They should be a good team worker. These are few qualities of the nurses they should possess by as to be a good nurse.
What is the regular routine of an ideal nurse?
Okay. So for ideal nurses are usually works in a three shifts. I will talk about the morning shift. Morning shift usually starts by 7:30. Duty starts with taking inventory, then followed by the handover from the previous duty nurse. Then the thorough assessment of the patient and carrying out the procedures and the orders given by the doctor, and duty ends with handing over patient to the next duty nurse.
One last question. As far as your profession is concerned, who is your role model?
In my profession, my role model is my ex head of the department. Though he was a doctor, but he always considered his profession as a priority of his work. He actually given us the uh, given us advices on patient first. So whenever you are at work, your all priority should go to your patient. And also he guided me how to deal with the patient, how the procedure need to be carried out, from where we'll seek the help. And really he is my role model in my nursing profession.
Right. That's very nice talking to you. It was a good warm-up session. Yes. Next, we'll move on to role play number 1. That is insulin injections. This is your card. So, do you have to prepare?
We'll start, sir, no problem.
Yes. Karuna Neherkar.
Sir, how may
Right.
I address you during role play?
Yes, my name is Abraham Lincoln, and you can call me Lincoln.
Okay, Mr.
So now we are going to start the session. Karuna Neherkar from Mumbai, Maharashtra, India. And this is role play number 1 regarding insulin injections commencement and explaining the procedure. Okay. He is speaking role play number 1. This is diabetes and insulin injections. Nurse, role play initiation. You can start, nurse.
Good afternoon. Am I talking to Mr. Lincoln?
Yes, nurse, I'm Lincoln and you are at my residence. Come on in, have your seat.
Thank you, Mr. Lincoln. Mr. Lincoln, I'm a registered nurse from this locality, and your GP requested me to get in touch with you. So, is this right time to talk to you?
Yes, of course.
Okay, thank you, Mr. Lincoln. So, Mr. Lincoln, your doctor might have told you about change of your treatment plan, and he has added insulin injection to your treatment. So, is that correct?
Um, Nurse, I believe that I have been managing my diabetes well, and I do not want to commence insulin injections. What's wrong with this doctor? Why does he want to change my treatment plan?
Mr. Lincoln, your concerns are really understandable, but as your recent blood sugars levels were high, so it is very much necessary to bring them at the normal level, and that is the reason that doctor has started with the injection insulin. I agree that you are managing your diabetes with the medication and diet, but at current situation, your sugar level is very much necessary to bring to the normal level, and for that, taking insulin injection is very much necessary. Is that clear with you, Mr. Lincoln?
Right.
Okay.
Nurse, please tell me if there is no other way to manage my diabetes because I am scared of these insulin injections. I'm afraid, so I do not want. So let me know if there is some other option, then why don't we go for that?
Oh, Mr. Lincoln, come on, don't worry. This is very simple procedure, and many diabetic patients take injection. And the pain will be just equal to the ant bite. Nothing. I assure you, it will be not more than that. Are you following me?
Yes, nurse, definitely.
Okay. Yes. And see, Mr. Lincoln, for your better understanding, I will explain you the procedure, so you'll get better idea how to take injection yourself. Is this okay with you?
Okay, nurse, if there is no other possible option, yes, there is no other go for me. So why don't you explain me the procedure of taking the injections, please?
First of all, I really appreciate and I'm glad that you are ready to listen and to learn about the injection procedure. So first, I would start from the common sites where you can take the injection. Can I proceed?
Yes, nurse, I agree with you. And yeah, go ahead. Tell me all the details, what I have to do
Okay.
and what I should not do, the precautions.
Okay.
Yes, everything,
Okay.
please.
So I will explain you the site. First, there are four major sites where you can take the injection. First is the upper arm outer side. Secondly, around the umbilicus, keeping 5 centimeter distance from the belly button. Third is the up front of the thigh. And fourth one is the upper outer quadrant of your buttock. Is that clear, Mr. Lincoln?
Yes, yes, nurse. Nurse, right.
Okay.
Now, I want to ask you one question. Should I
Yes.
change the place every time, or should I take the injection in the same place every day?
Mr. Lincoln, this is a good question from your side, and I would like to answer this question. So you can change site very frequently, so it will not injure your uh, same side, and this may lead to some hardening of the skin. So it is always better to change site frequently. Are you clear?
Okay.
Okay.
And
So
nurse, actually, the thing is, yeah, how is this possible? I'm not a nurse, and I do not know anything about this. And if anything goes wrong, then what am I supposed to do? And what will I do if there are any side effects?
your concerns are really reasonable. But don't worry, I will explain the procedure to you and you will be confident. I am sure you will be very confident, and you can take your injection yourself and you'll manage it very well. So can I proceed with the procedure first?
Yes, please go ahead.
Okay. First of all, whenever you are taking injection, please gather all articles, including syringe, injection vial, and the alcohol swab. Secondly, clean your hand. Wash it with the soap and water. Third, withdraw the necessary required amount of insulin from your in the syringe. Fourth, clean the site where you need to be taken injection with the alcohol swab. Let it dry for 2 seconds and then inject it gently within the site. Once you inject all the solution, withdraw the needle gently, and you are done. How easy it is, doesn't it?
Yes, nurse. Okay. I go with you. I understand what you're telling. But now, what about these things? The used syringes. Can I use them again, or should I throw them
Uh,
off?
It is very good question from your side, Mr. Lincoln. See, the syringes, these needles, insulin needles are meant for the single use, and I would recommend you to use puncture-proof can to dispose this. So for that, you can use a hard plastic can or maybe a cardboard box. Are you able to do that?
Yeah. Do you not provide any disposable container for these things? A safe
Right now,
one, something like that from your facility?
yes, Mr. Lincoln, we do provide the puncture proof can, but right now I don't have the puncture proof can with me. But whenever you will come to the facility, bring it on my next visit. How does it sound?
Right. Yes,
Okay.
that's fine, nurse. That's really very
And
fine. Thank you. You have
uh,
given me a lot of
and
uh,
and one
yeah,
more point I
information.
would like to add in our in your information that periodically you have to hand over this scan to the nearby medical facility. Are you able to do that?
Yes, nurse. Definitely, I'll follow all your suggestions. Thank you very much.
Thank you, Mr. Lincoln, for listening me patiently and for agreeing to take injection as advised by the doctor. I am sure it will help you and it will bring your sugar levels to the normal. And once it is normal, then I feel that doctor may change you to the tablets again. So I hope for the best and wish you speedy recovery.
Thank you very much, nurse. You have given me a lot of information. That's really great. Thank you once again.
Thank you, Mr. Lee.
So we are moving to the next part. That is role play number 2. Yes, this is your card. Now you have 3 minutes to prepare. And if you're ready, let me know so that we can start. Yes. Are you ready, Neherkar?
Yes, sir.
Yes, you can start now.
Good afternoon.
Good afternoon, nurse.
My name is Karuna Neherkar, and I'm one of the registered nurses working in this children hospital. You look upset. What happened to you?
What is this, nurse? You come after 1 hour. Okay, I have been waiting here and for a long time, and now you come and you ask me, how is your child's condition? It's not fair enough. It's not. I don't like this, what you're doing. And really, I'm very much upset with your treatment to the patients.
I'm really sorry to make you wait for a long time, but being an emergency unit is really running busy, and all the doctors and nurses are busy handling critical patient. So it took long time to come to attend you. It took long time to attend you, but I hope you will understand the current situation. For our
Um,
fluent conversation, it will be better if you tell your name to me.
yes, my name is Margaret Thatcher, and you can call me Maggie.
Okay, thank you, Maggie. So, Maggie, would you please explain me what happened to your
Yeah,
child?
you know, my daughter is 3 years old. and she was brought to the hospital suffering from chest tightness, wheezing, and dyspnea. And I suspect something serious. Okay, I'm very much anxious. I'm very much agitated because of the child, and this irritated me more. I could not see the doctor even till now. There is no sign of any doctor. I don't understand what's happening over here.
Oh, Maggie, please try to understand. And I can understand that being mother, it is very difficult for you to see child any kind of discomfort or pain. But try not to worry. Your child is really stable. And we are here to help you. You are at safe place and in safe hand. So try not to worry about your child's condition.
Okay,
Okay.
nurse. And I don't know why you are not going and getting the doctor here. What are you going to do with my child? What is the plan for you?
Yes, as I said, the doctor is busy in settling the critical patient. Once he will be done with that, he'll come and see your child. Meanwhile, I will check all the parameters of your child, which includes the temperature, his respiration, and his blood pressure. So we'll get a good idea. And I also suggest you not to self-diagnose. As you said, his child might be having asthma, but I recommend you not to self-diagnose and wait till the doctor's advice.
Okay, that's really
Yes.
fine. And
Okay.
then, nurse, I doubt that my daughter has
Hmm.
asthma. Why don't you
Hmm.
confirm that? I want you check now. Now, at this moment, you
No.
check and let me know that my child has asthma because I doubt it.
Your question is really sensible, Miss Maggie, but I'm not the right person to diagnose. It is out of scope of my practice. Doctor is the right person who will diagnose the condition, and once it is diagnosed, we will do all possible things to for your child. Are you clear with that?
Yes, nurse, of course. And then, right. So, how long will it be till the doctor arrives?
See, Miss Maggie, the patient which doctor was handling is about to settle, and I think it will take hardly 5 minutes more to come here. So, meanwhile, I'll check the child's vital signs, as I told, that his breathing pattern and blood pressure and temperature, and I'll give all the information to doctor. It will be easy for him. So once he comes here, he'll do thorough assessment, and based on that assessment, it will be a very easy for him to diagnose. So I request you to wait for more 5 minutes. Is that
Yes,
okay with
nurse,
you?
thank you very much. If there is nothing else, then okay, I have to wait. There is no other option. So I'll wait until the doctor comes. In the meanwhile, what you want to do, you can carry on with your procedure.
Thank you, Miss Maggie, for agreeing to wait for the doctor. Now I will proceed with checking his vital signs so I can provide the information to the doctor. Meanwhile, if you have any questions, you can ask me. And please do not hesitate to ask anything. I surely help you with that. Is that clear with you?
Yes, nurse, thank you very much. That's very nice. Have a nice day.
Thank you. Thank you, Miss Maggie.
Yes. Now, fine. Right, that's great. We have had a session, wonderful session, and that's really okay, fine. Now, Karuna Neherkar, let me give you the feedback. There are too many pauses and breaks in the beginning,
Okay.
especially in the warm-up session. So try to be confident and improve your quality. Then pauses along that one, you're making unnecessary sounds. Suddenly you get stuck and then you don't know what to say. And then after a few seconds, you'll recover and get back to normal and continue with your speech. That's fine. That's not a problem at all. But in the middle, you are using like that sound. So that is not advised. And then third one, you have used the word advises. Advises. There is nothing called advises. There is advises. That is verb, third person singular, but not, it is not it is not you say, right, recommended. So there is nothing called singular and plural in advice or advices. So the only one thing is you have to use the word advice. That's it. You have to use the word
Yes.
advice, and there is
Advice.
nothing else. Next, you said levels were high. Blood glucose levels were high, or some blood levels were high, or whatever you have said. Were high.
Okay.
You can say are high. The
Okay.
simple present tense, are high means yesterday, today,
Presently.
tomorrow. In a general sense, not present tense, general sense. Current situation, that is the meaning. Okay.
Yes.
So nowadays, these days, like that. Then increase the quality. You have to increase the quality a little bit. How can you increase the quality? Because of some special usage, special style, and other things. And the first, the second, the third. You're saying the first, the second, and the third. So you are supposed to say what? The first, the second, the third. But you said first, second, third. So these are not, okay, these are not cardinal numbers, these are ordinal numbers. Ordinal numbers means order. They're coming on
Okay.
order. The first, the second, the third, like that. Okay, order. They relate order. That's why. One means 1, 2, 3. You need not say the. But first, second, third, you have to say the. Next one is, you can see here, is this, avoid repetition. Don't use the same words or same phrases or same sentences time and again. Okay. Don't use them again and again. Use once only, as far as possible. That is called avoid repetition. The next one, use complex sentences, compound sentences, and simple sentences. In one instance, you used though, and in the second part of the sentence, you used but. In one sentence, how can you use though and but? Though is showing you complex sentence, and but is showing you compound sentence. So how can you make one's ordinary combined sentence into complex and compound? No. Either use though or use but. Though he is clever, he failed in the exam, or he is clever but he failed in the exam. So you can use any one is enough. Then why are you using the second thing? That it is redundant. Redundant means it is more than necessary, it is unnecessary. So next one, how is that? That is monotonous. How is that? How does that sound? Okay, that's fine, but what I'm saying is, what do you think about it? Are you going to follow these suggestions? Okay. Only one word, how does that sound? And once you can use, not repeating. So next time when you use, you change the style. I hope you understand the situation and adjust to the demands. So this is a stage where you cannot manage with the diabetes diet, regular medication, and physical exercises. Otherwise, we would have recommended to continue. But after seeing your blood levels, we conclude that the condition has gone far beyond normal conditions. And managing with the existing treatment is highly impossible. And the conditions may deteriorate. And therefore, the doctor has recommended the commencement of insulin injections immediately. I hope you understand the grave situation and comply with the suggestions for your own benefit. Is that clear, Karuna Neherkar?
Yes, sir, very much.
Are you able to follow what I'm telling you?
Yes, sir, I can get.
I'm really sorry because it's just 1 week. How much ever we can do, we could do, right?
I know, yes, sir.
Because we have to, classes are more important, correct?
Yes.
Lectures and classes are more important. So I was focusing on those things more, but still, right. Next one. Excellent command of the subject. You have very wonderful knowledge of insulin injections and also this child asthma related thing. Everything you have good knowledge. So you have done, executed the information, passed on the information very well. And fluency, of course, good, right? There's no problem in the fluency, except that those pauses and breaks and unnecessary sounds. The next, accuracy is average. Accuracy means grammatically and vocabulary wise and pronunciation wise, correctness. So it is, you have to improve there. And then avoid using pronouns I, we, you, he, she, all these things. Then what else? How we have to avoid that is using passive voice. Next one, use passive voice as far as possible. That's it. Is that clear? Was the feedback beneficial for you?
Yes, sir. It is really beneficial.
Okay, dear. Anything? Now tell me, give me your feedback. How you felt regarding the session today? Is this before the exam? Is this going to be somewhat helpful to gain your confidence, or did it break you, or was that totally useless, or was that
No,
something helpful?
it will build more confidence, sir.
Yes, tell in your own words. I'm giving you 2 minutes.
Okay, so the session was really helpful, and basically the feedback and from whatever you have explained me, it will really really benefit me in my conversation during the role plays.
Right.
I will try
Okay,
the
thank you.
implement advices.
Yes. Okay, then have a nice day. Bye-bye.
Thank you, sir. Bye.